The talk this morning is really a continuation of what we were speaking about yesterday, but I'm really going to shift from the oral microbiome. And by the way, thank you for all of you that came up to me. The product is not available on Amazon yet. You could just go to revitin.com. We do have a doctor's affiliate program, so you get the product wholesale for you to be able to share with your patients. And it's important because what I'm speaking about today is that oral health really is the 800-pound gorilla in the room for the wellness movement. And you can't ignore the 800-pound gorilla. And I did not get that orangutan to brush with Revitin. I did find that online though. So we do know that you really can't be healthy without a healthy mouth. That's a bottom line, RockSolid Principle. And the person who really I mentioned yesterday, who's not only recognized as the Charles Darwin of nutrition over here for his work in that, but he really pioneered so many of the concepts that we now know are true. So in nutrition and physical degeneration, he just had that the aspects of a Western diet, flour, sugar, modern processed vegetable fat, we know hydrogenated fats, cause nutritional deficiencies that are a cause of many dental issues. But it also included the proper development of facial structure, and then he postulated that this would affect subsequent generations, that it damaged the genes. And that was a concept that was even unknown to me throughout my dental education, that we actually damage our genes and we can repair our genes. And that is where I, sort of had an aha moment. I read a book, I'm sure many of you have as well, by the cellular biologist at Stanford University, Bruce Lipton, wrote a book on the biology of belief. And the actual idea that energetically, what we believe in our faith can actually change our genes. So in 1917, Western Price presented to the St. Louis Dental Society, and which was a division of the American Dental Association, which was newly formed about 50 years before. And I love this over here. He basically says, I'm going to present you with a new truth. The present state of our knowledge of the relation of mouth infection to systemic disease. This is April 1917, and he says a new truth is identical with a new sense, and it's really kind of just what I presented yesterday on the oral microbiome. So many came up and said, that it's such a unique new understanding that we're made of bacteria and the bacteria run us, and all of these things that we thought were part of our human cells are really being directed by the bacteria. So, and then again, I think this is 1926. He has dental infections and related systemic diseases, and what he says is the relationships between dental infections and degenerative diseases should be, if such exist, should be demonstratable by other means than the establishment of simply an association of two in the same person. And he was looking at ways to actually prove that this existed, even though he was postulating this years before. So, and now here we are in 2017, and basically periodontal disease can give you upwards of 10 times greater chance of heart attack or stroke, 7 times greater chance of adult onset diabetes, a 700% higher incidence of pregnancy complications, 67% incidence of pancreatic cancer, higher incidence pancreatic cancer in men with advanced periodontal disease. That was a study that was done at Harvard. So everything right down the rheumatoid arthritis, huge component is an unhealthy and unstable, unbalanced oral microbiome. So I wrote a book. There's a book out there. I just wanted to tell you a little bit about why I did it. It's written for the layperson. It's really written for the guy. I thought of getting the overweight guy on the drive-through at Burger King, off the drive-through, and it's written very simply, and it's a book that you'll find very interesting and an easy breeze to get through. But at the same time, your patients will find it more interesting to recognize the importance of a healthy mouth with a healthy body. So we always knew that the mouth was a mirror to the body. 75 to 80% of infectious disease has signs and symptoms in the mouth. There's a very unique ulcer for tuberculosis, diabetes, HIV/AIDS. I came out of dental school in 1983 in New York City, and it was a really tragic time when the AIDS crisis was just kind of coming into a cascade of really ravaging a young population, very young population, and we would see bizarre fungal infections that we would never see, and we knew it was acquired immunodeficiency syndrome, so immediately we would have an HIV test ordered and things like that. Things like leukemia. I've diagnosed lymphomas in the mouth. So lots of things we know that the mouth acts as a mirror to the body. And of course, all of you and many of you who are steeped in Chinese medicine, one of the first things we look at is the tongue. Over here, that bright red is often a symptom of vitamin B12 deficiency. Tongue fissures, very interesting. Common symptom, 20% of patients with a psoriasis skin disorder. The white creamy patches we always recognize as candidiasis. So the tongue is a really important diagnostic organ. So, and we do that all the time. This is, I have this up in every treatment room when I have a patient who has root canals, and I do want to say something because I had like sort of a conviction last night in thinking about you, Lori, and about that lower root canal, and about the fact that on a meridian scale, that's all kidneys, bladder, ovaries, and right down uterus, and it's right there, and I would recommend getting that out. I mean, that's really, it's the only one you have too, which is part of the cleanup of everything that you'll be doing. So I did want to say that. I mean, I had a patient came to me with this tooth here this past week, endodontically treated with a cavitation. I mean, I had a cone beam, it's infected, and I'm explaining to her this needs to come out, and she's asking for her treatment options, and I said, well, the restorative options, are a bridge or letting it heal, and placing a ceramic dental implant, but really, you could even leave that edentulous if it's not an aesthetic issue for you for now. So I gave her all the options, and she's like, well, what about retreating it? So I got into this whole thing about why root canals fail, which I'm going to speak about in a few minutes. And then I said, look, let me just show you, and I bring up this, and I said, there was a study done by one of our colleagues, Stuart Nunnally did a study. He screened, I forget how many patients who had breast cancer, and he found that upwards of 90% of them had root canals on their upper first molars, and it was a correlative type of analysis of a spectrum of patients with breast cancer, and certainly that causative analysis is not something that has to be investigated further. But this patient, I was telling her, look, it's connected to your breast, thyroid, and then pancreas. And she said, oh my God, I'm seeing an endocrinologist on Thursday. I have pancreatitis. And it was a festering abscess, a dark area, cavitation, the cone beam. And I said, this should come out immediately. So educating the patients, and because conventional dentistry will say, no, this is ridiculous, you can't prove this. The same way, they discounted homeopathy. A lot of Western physicians discount homeopathy, which we know is an energetic medicine. With advances in quantum physics, we can give a very credible explanation other than observational. And it's a system of medicine that's been around for, over 200 years that I've believed in and I've used. My wife, we had our second child. The first child we had was delivered by cesarean. My wife had pelvic disproportion. She was in labor for about close to 26 hours. And then finally she was taken in for a section, and she couldn't even get out of bed the next day. And it was around the time that I was in this master's program in holistic health in New York, and I started using homeopathics, and our second child was delivered by cesarean, and I was giving her arnica, and using different homeopathics to help her through, and it made the experience completely different for her. And I was, so many stories using, even in the dental practice, and aconite and hypericum and hepsulf and all these different homeopathics that help with improving the condition of the mouth, and makes treatment for patients a lot easier. So the mouth as a gateway, this whole mirror and gateway, that was the theme of my book, The Mouth-Body Connection. And so this, the idea of the mouth as a gateway is a really, as we know right now, it's a hot topic and a very hot button. So we have right now some estimates anywhere from 60 to 80 to 80+% of adult Americans have gum disease, some stage. The reversible gingivitis to periodontitis, early, moderate, and advanced periodontitis, and walking around. We have pregnant women seeing their OBs and really not being advised about the, as a matter of fact, the OBs are saying, don't get any dentistry done while you're pregnant. And they have pregnancy gingivitis. So, and pregnancy gingivitis is a source of inflammation. And it happens, it's a natural process. In the old days, they would say the reason why many women lost their teeth was because the baby robbed the mother's calcium. And it was gum disease. It was a wives' tale, it's gum disease. And gum disease really kicks in women in childbearing years. So it's something that really should be addressed. And, if anything, I think they should, a woman should have a periodontal maintenance should be done once a trimester during pregnancy. And I would definitely have that patient using a prebiotic, and that's why Revitin reduces inflammation so potently. And it's great for my daughter had absolutely no issues throughout her pregnancy, with her mouth. She was really responsible and delivered a beautiful baby, which I'm grateful for, and because a lot of things can go wrong. And I had everything going through my mind in the toxic world we live in. But she nutritionally is conscious and was conscious about doing everything she could to keep herself healthy for the baby. So we look at the mouth as a gateway to the body. This is a little old, but stroke, 300%, heart disease, 160. Yeah, this is actually a lot higher. The interesting thing about heart disease and gum disease, cardiovascular disease, is that if you get a heart attack and you have advanced gum disease, it's the big one. It's going to kill you. So the heart attacks you get from gum disease has over a 90% fatality. Preterm birth, oral cancer, colorectal cancer study came out in October. Right now, I just got it in my phone, a new study that came out on the link between gum disease and colorectal cancer. Now it's a direct causative link. And they actually found Fusobacterium nucleatum in an oral bacteria in the colorectal cancer. Okay, this has just stopped. Maybe I turned it off. Hold on. There we go. The epidemic problem of gum disease, yeah. I argue with one of the colleagues in my company about this, but there's the NIH has 85% over 35, or the CDC. So the link between gum disease to systemic illness is well established. And past approaches, the scorch and burn, antibiotics and antimicrobials, are not only ineffectual, but harmful. And that was because of our immature understanding of the oral microbiome. Time magazine in 2004 had a cover about chronic low-grade inflammation. They called it the secret killer, and it said the secret fires that burn within us. So chronic high-grade inflammation, you get a splinter in your finger, swells up, it's a normal healing process, it resolves, and inflammation is a normal body process, a regulatory process. But when it becomes chronic and low-grade, it's like a silent alarm bell that's going off that's not being answered. Things start to go seriously out of whack. Paul Ewald, his name didn't come up on there, but anyway, he wrote this book, which I read about 20 years ago, on how stealth infections cause cancers, heart disease, and other deadly ailments. And gum disease has always been recognized as a stealth infection. It doesn't hurt. There are some symptoms like, oh, my breath smells. Oh, my teeth are moving. Oh, my gums are receding. Oh, yeah, it's a little sore. It bleeds. I love the patients who come to me and say, oh, my gums bleed when I brush, but I'm just brushing too hard. And I look at them and I say, well, when you brush your hair, if your scalp was bleeding, would you think you're just brushing too hard? You know, and it becomes I'm like, no, that's inflammation. That's a sign of inflammation. And it needs to be addressed. It's not normal. You know, and then there are some dentists say, oh, just don't brush so hard. You know? So, and the reality is that in the normal process of, you know, daily maintenance and care, you know, there are lots of things that we ignore that we should pay attention to. So, so let's talk about what goes on, just so you know you have an idea. I mean, this is inflammation of the gingiva. What happens as it progresses is there's a cascade of events that cause, you know, gums just don't recede because what the process of gum recession is. You begin to destroy, and I'm going to talk about the pathways of this, but you start to destroy the alveolar bone, and then actually gum recession is the body's way of trying to heal itself. So this inflammation goes down, and now you have the gums down here, and you have these funny roots showing, and that usually it's usually the cosmetic you know, condition or the social problem of bad breath or something that gets a patient to deal with it, because this destructive process is relatively painless. You really don't experience that much. So let's talk about pathways, mechanisms and pathways, because these are very important. You have the direct effects of oral infectious pathogens just going into the circulatory system. And then you have this inflammatory response to oral pathogens. So we observe like an elevated C-reactive protein, like oral bacteria, pathogens, disturbed. I want everybody to think not in terms of good bugs, bad bugs. You have to just think of bacteria as people. When they are disturbed and unhealthy, and you know they are, you know, and we've seen this around the world in countries at war and things like that, where, you know, there's a degeneration that goes on. So think of oral pathogens as disturbed, imbalanced bacteria. They're out of balance, and they have flipped the pathogenic switch, and they get into the circulatory system. They trigger the liver to release C-reactive proteins, which is an inflammatory marker. So we have this inflammatory response. Something else happens, and I showed you yesterday how ionic oxygen that are created by bacteria that are out of balance, these free radicals poke holes in the cell membranes of the gums, and they suck out the cytoplasm, like candy, and that is another inflammatory. So that's the inflammatory effects on vascular integrity. The inflammatory effects on vascular integrity is another sort of step in the periodontal, how we get to this inflammation, how this inflammation goes systemic. But the fourth one is the one that a lot of research being done on this right now, these gene polymorphisms to a more inflammatory genotype, which is the interleukin genes, the IL genes. And we're seeing that this is actually where the link to cancer seems to be the most prevalent. So effects on vascular integrity, these inflammatory effects on vascular integrity, yes, but it's the gene polymorphisms that are an area of a great amount of research on this link. So let's look at the next mouth-body connection, the one that has been probably the most embarrassing for me as a dentist. This is barbaric, and if you go back to the history of the use of dental amalgam in dentistry, it's bizarre being introduced and brought here. But around the time of the revolution, we were using there were dentists putting lead in teeth. So mercury was a step up from lead, and we. We see patients all the time with these that are in for 30 years, 40 years. And when you start to see them like this, do you see how it doesn't look shiny anymore? You see how the margins are? This is corrosion. I was taught in dental school that the corrosion of a dental amalgam was good because it kept it sealed, so you didn't get decay underneath, and that corrosion was good. Actually, that's a bunch of BS. We take amalgams out with wicked decay underneath there. And we also see that this metal, especially in a state like this is the classic tooth. Actually, this one here, this is called an MOD amalgam. And this is the classic tooth that the patient bites on a Brazil nut and the tooth splits in half. And the reason for that is that this hunk of mercury metal, 52% mercury, 26% silver, everything else, alloys, copper, tin, zinc. The metal acts like a wedge splitting a log. So if you imagine, you bite on something hard, the amalgam is leaking, there's decay underneath it. You bite on something hard, this now becomes akin to chopping wood, but the wood is your tooth. And sometimes you lose the tooth. Sometimes the dentist says, oops, we got to do a root canal. The nerve's exposed. And you get into this whole scenario so we never want to see amalgams get to the state. This is totally undermined over here. This is one where the patient will swallow half the filling. There's a crack over here. And you see the crack in the natural tooth down here? This is very commonplace by patients walking around with dental amalgam fillings. Let's talk about mercury exposure and where it comes from. So most medical doctors are telling patients who show up with an elevated mercury, stop, don't eat so much tuna. And by the way, swordfish, everyone knows swordfish is the highest in mercury, and then I think it's tuna, and then I think salmon, I'm not sure, but you really want the fish that have the lowest amount of mercury are the whitefish that higher to the surface, right? So the greatest amount of dental amalgam, the World Health Organization, that has said that 90% of the world's mercury pollution is coming from dental offices. You have industrial over here, and they've got scrubbers and things that they're using, but coal-fired power plants and things like that, seafood. Vaccines and amalgams are hand in hand. That's where we're getting the most amount of mercury exposure in our environment. And so what are the symptoms of mercury poisoning? What are the symptoms of Alzheimer's disease? They are exactly the same. From irritability, anxiety, depression, memory loss, agitation, physical or verbal outburst. I mean, I had all of these about 15 years ago. Sleep disturbance, I didn't have delusions, at least I didn't think I did. But I had irritability, I had, well, my wife would differ. So, it was really, and I hadn't placed a dental amalgam since I came out of dental school, because I knew it was crap. And I refused to place one, but I was taking them out, not even thinking like, well, I got a rubber dam and a high-speed suction. And the amazing thing, and you'll see in a moment, is that the protections that we now use are incredibly different than what we would think. I mean, we have the International Academy of Oral Medicine and Toxicology has done probably the greatest amount of research in this area. The entire organization, a cornerstone of the foundation, and the chairman of IOMT is here, Dr. Jack Call, who is a native from Louisville. They've done a lot of work, and Dr. Wisnowski is also here, Mark, introduced this program, which I think is great, because being a member of IOMT is great, but how do we know you're really doing this the right way, and how do you let patients know you do this? He came up with safe mercury amalgam removal technique, and I was one of the first in New York City. I thought it was brilliant, and the protocols are not only in isolation of the patient, but protecting your staff. I was saying yesterday, there's so many young women that work with dentists as dental auxiliaries and dental hygienists, and they're pregnant in the office, and they're front desk. You have really there's a dental assistant. Actually, I'd recommend everyone take a look at the movie Evidence of Harm, which was produced by IOMT, and it was directed. It's well done, Evidence of Harm. And it has sort of the stories of a number of people that have experienced, it gets into the politics and the history and everything else, but that have experienced toxic effects of mercury poisoning. The alternative restorations look a lot better. We have some great things. We have 3D printers in our offices now where you can scan the tooth after you remove this stuff. You can scan the tooth and do some really great dentistry that increases the internal stress. There was a study at the University of Minnesota back many years ago. It always surprised me. They took 3 extracted bicuspid teeth. One of them was a virgin tooth. One of them had an amalgam filling, and one of them had a one of these etch resin bonded composite fillings at the time, and they did a compressive strength on the top of the tooth. The first tooth to blow apart was the amalgam tooth. Of course, we know that. Amalgams actually weaken teeth because of the preparation that we do to put them in. The second tooth to blow away was the virgin tooth. And the tooth that was the most resistive to compressive force was the tooth that had one of these etch resin bonded composites, and they showed how it increased intercuspal stiffness. So we can actually create even stronger teeth when we replace some of these mercury fillings. I use this product a lot. This is a zeolite. It's actually hydrolyzed clinoptilolite fragments, and it's a specific zeolite that has lots of different binding. It has a great binding capacity for mercury, and it's I squirt it right in the mouth, 10, 15 drops right after I use activated charcoal and chlorella. We kind of prep the patient with activated charcoal. This is great to use after the mercury's out, and it's an excellent binder. let's move forward a little bit, and let's talk about another hot topic, and about how a root canal could be making you sick. And I'm actually in the midst of writing a protocol about this, but a book was done by Bob Kulatz, and Bob I was president of my class for 4 years at NYU. He was president of his class, and he was 2 years behind me. He was a great student. He was a super nice guy, and like Dr. Tom, he had his license taken away because he had done a lot of research on the toxicities of root canals and why they really don't work for a lot of reasons. In more than, I would say, 90% of the time, they don't work. I would say, I used to say, well, 60-40, 70-30, and it's like they really don't work. There's only certain cases that I think a root canal as a compromise would work, and that is, and I'll explain what those conditions are in a moment, but this is typically, what we see. Here's the root canal filling into the bone, which they say, oh, it's no big deal. The macrophages will come and clean it up, and we were told all kinds of things. And this here is a giant cavitation. Down here, you see these two halos around the roots. We see this stuff all the time. So what we believed is that a tooth gets decay, normal tooth gets decay and the nerve dies and there's an abscess here. So we go in and we clean out these canals and we put this inert filling material called Guttapercha, which Guttapercha is like a rubber material. It was bacteriostatic. They actually used it in World War I when we had a rubber shortage. They were making tires out of Guttapercha, and they even used to make prosthetic teeth, dentures with Guttapercha bases. But the Guttapercha kind of flows in the canals, and if you're really good and you melt it and you use a thermal technique, the Guttapercha goes into these little tubules at the side where it forks off. And this is where another kind of archaic understanding comes into play. We were taught in dental school that this will just go away. Okay? That, and we know you need a blood supply. You need, it's very interesting what can happen in bone when you think this just goes away. So I immediately, if I see a tooth like this, I recommend extraction. And I also give the statistics on the stability of a dental implant versus a root canal. When you do this procedure, it's the equivalent I explained to the patient, just the physical properties of the tooth change. Yes, the tooth is in your head. Yes, it doesn't hurt anymore. And yes, the swelling went down from the acute infection that was going on, but you now have a tooth that essentially is dead. And when you have, I explained, when you take a branch of a tree that's alive and you bend it, it goes, it has a resiliency. When you take a root canal tooth, the root canal tooth is the equivalent of a dead branch of a tree, and you bend it and it breaks. So very often we see microfractures in roots and all kinds of other problems. But the biggest issue is that this yellow part of the tooth called the dentin has thousands and thousands and thousands of tubules that bacteria can harbor in. So you're never really sealing the tooth. And this is what an infected root canal tooth looks like when it comes out. The patient had no pain, no swelling, and but this is, I take pictures of these, when they're removed, and I'm going to go through how we treat the socket, how we treat the healing process. I'm sorry for the graphics, if anyone's still having their quinoa bowl. So the dangers of root canals are arthritis, heart disease, neurodegenerative. We see a lot of this, neurodegenerative disease. digestive disorders, mental disorders, and cancer. And obviously, we see this depending on what meridian path that tooth was affecting. So in that tooth-organ relationship, it's amazing. I'm seeing, as I mentioned yesterday, seeing a patient on Monday who's got two giant third molar wisdom teeth area cavitations, and those are connected to small intestine. She's been suffering with her small intestine, just suffering. So I'm very excited to see what her healing response will be just by cleaning out that toxicity. I'm going to show you one of the things that I'm most concerned about with, this is really interesting because when you end up with a cavitation, I want to see, I think did I jump ahead? Okay. Cavitations in the jaw do lots of different things. Sometimes they're totally, you don't even know they're going on. I actually want to go to this slide first. This is what a cavitation looks like in the jaw. Somebody told me that yesterday that at Thomas Rouse, they extracted 6 upper teeth that had cavitation above it, and it looked like black motor oil coming out of the jaw. It looked like black. You had showed me, right, Ian? That was your brother. Yeah, Ian's brother. And this is actually what it looks like, you know, in these areas. This is necrotic debris. This is what normal bone looks like, and this is a cavitation. So, but the one that I was in dental school, and my cousin's wife was suffering with what they were labeling trigeminal neuralgia. And actually, I believe she was suffering from she was 25 years old. She had her wisdom teeth out at 18 or 19. And I believe it brought on what we call NICO. NICOs are really, these are the people that have incredible pain, and the dentist, and the patient's going right around here, right around here. The dentist doesn't see anything, and finally says, okay, we're going to pull a tooth. We're going to pull it. And that's from NICO, neuralgia-induced cavitational osteonecrosis. And what happens is the cavitation strangles the nerve branch. And you have this necrosis of the inferior alveolar nerve that they label as trigeminal neuralgia. Anytime we don't know what something is, we call it a neuralgia. And they, with my cousin, she lost 8 teeth. 8 teeth. Beautiful, healthy teeth in a young woman because they didn't know what they were looking for. And so they pull this tooth, and they pull the next tooth, and they pull the next tooth, and she's still dying. Well, a little bit, no, it's still hurting. And it just went right down the row. And it aged her tremendously, just the pain and everything else. And I know that it was probably a cavitation from a wisdom tooth extraction that never healed. And actually, John, you were talking about that there are 3 contributory factors: not removing the periodontal ligaments, problem with microcirculation, and direct infectious pathogens that form in the base of that cavity. So I'm going to just go over a brief protocol that I've used. This device has changed my life. This is the Waterlase 2.0 by Biolase. It's a dental laser that does some incredible things. It's got a wavelength of light, erbium chromium YAG wavelength of light, that has been shown to cause mitotic division of osteoblasts. So the osteoblasts that make bone, it actually grows bone back. So it's one of these. I love the regenerative properties. So it makes ozonated water. So the laser creates ozonated water. It nukes, literally, the diseased tissue, and then it stimulates the healthy tissue, the healthy bone, to grow back. So those three things, this has become really a standard tool that we use. We're going to have that same tool in the Providence Center. We're going to have that. It is absolutely fantastic what it can do for patients. Another very exciting area was the discovery of the use of platelet-rich fibrin. Platelet-rich fibrin is rich in mesenchymal stem cells. It is great for bone augmentation, stimulating bone regeneration. So we're using this in all kinds of cavitations now. It's a standard protocol. We take a few vials of the patient's blood and we put it in this centrifuge that's set at a lower speed that like 1200 RPMs that for 700 to 800 RPMs at 12 minutes. And we're able to get this, the blood separates, and you have, these are the red blood corpuscles, and then here is the PRF, and this is just acellular plasma. This is plasma. This is the PRF. So when you take this part out, it looks like these, almost like jellies, and we put it right into, here's a cavitation from a baseball accident. This guy, baseball, hockey, anybody, we have hockey, baseball. This is what a cavitation looks like. This was almost up to his nasal cavity, and it was just being left there because the tooth was in there. It didn't hurt. But anyway, we go in, clean it out, use the laser, fill it with PRF, so, and then we let it heal. And the healing, a lot of times this PRF stuff actually helps, it stimulates, patients have much less trauma with the laser and the PRF, no trauma. In the old days, doing it mechanically, it was traumatic. And anytime you do trauma to the bone, you get swelling and pain. With the laser, it's so atraumatic that patients don't even get swelling. They can't believe they had this done. So it makes the entire process a lot easier to tolerate. And with that, so anyway, the book is here. I have books to sign and give you. Reviton bought a bunch of books, and they'll give you a book if you, I think if you buy a case of toothpaste, you'll get a signed book, or you could just buy a signed book. But I'm going to do that on a break. And the really nice thing is it's a great book for you to have out for your patients to read, because it gets them to understand that these two things are connected. The important thing, what we're going to try and do in Providence, and I'm really excited about that. I actually gave up my personal plans to build a new office in New York City because of Michael Baldwin and his commitment, and he's bore the biggest burden of helping to make this happen along with a group of us. So please give him a hand. But Michael is an amazing, selfless person who has done an amazing amount, and I think he didn't know what to make of me at first, but I really, he's like, this guy is really animated. I sing on stage, and so I'm really, and I want to thank Jessica Daniels, who brought me to Michael, or brought Michael and I together. But I'm so excited about Providence. I'm so excited that we can do good bioregulatory dentistry with bioregulatory medicine. I think we're going to set a standard of care that's going to be an example for the rest of the country and internationally, and even Paracelsus. So it's terrific. Does anyone have any questions? Yes.
So I'll just use myself as a 30-second case study. I would always say through my life I had more amalgams than teeth, and some of them were broken off or whatever. And in my introduction to biological medicine, when I worked in a clinic in Vermont, I became aware of all of this So
Yes.
I did have all of my amalgams removed and my root canals removed.
Did you have them removed safely?
I had them done at Rocky Dental Wellness.
Okay.
By Bob Evans in the day.
Okay.
Around 2008.
Mm-hmm.
Yeah, and including my two front teeth, because I had a trauma when I was a kid and pulled out my two front
Yeah.
teeth, for which I wept from the depths of my toes just for the emotional release of
Yeah,
whatever.
by the way, we treat those injuries in the anterior region very differently now.
At the time, I remember Bob saying, and I was just learning about cavitations, that I did have a cavitation from the top of that front root canal tube right into my left nostril.
Yes.
So in the day, not having the same technology, I mean, what might have been done? Would it have been cleaned out?
It would have been cleaned out, yeah.
Healed?
Yeah, and we injected ozone a lot. We used a lot of, by the way, injecting ozone, if there's a, if sometimes we need to go back in and inject ozone. We wouldn't reopen you, but injecting ozone can be effective. I don't want you to think that what was done back then, it was just, I'm sure you had a much more difficult path than you would have today with the advances that we have. Now, I mean, I just love PRF. I just see, and it's a biologic way of grafting the patient. We're not putting porcine bone or bovine bone or cadaver bone. That's what we're human bone. Another part to your question?
So, in reference to that product, the detox product, do you actually recommend that people use that while they still have their amalgams?
Yes. Well, good question. Really good question. That is a chicken and the egg question. I do have them use it if I've actively removed, because everybody knows the biggest thing that came out of yesterday with the panel of doctors that were here is when you're detoxing, slow. Like Hetty said as well. It's like our bodies have an ability to balance. Sometimes detoxing throws them out of balance and they get really sick. So you never want to do 6 amalgams in one day. I do two. And I tell them this is a path. It's like Rome wasn't built in a day, Rome wasn't rebuilt in a day. So the path to health, slow and steady. And for Alex, I'll use my Russian expression, Tisha Yiddish, Daksha Budish, which means if Alex is here, the slower you go, the slower the horse goes, the farther it goes. And there's wisdom in that. And in Italian, I'll tell you that one too. Chi va piano piano, va sano va lontano, which means nice and easy, you go long and far. It's amazing. That's the same thing. Hetty, did you have a question? Or you have something to add?
You're wonderful, that's all.
Well, I know in the past, some dentists would use galvanicity to determine the sequential removal of the amalgams. Like, should it be going into finding the most, either highest galvanicity and removing that one, or what do you think about that?
You are 100% correct. So, Lori, you're our poster child today. For the weekend, you're our poster child. You have a dental amalgam next to a gold filling. That is a galvanic. There's a galvanic current that's going on there from dissimilar metals. And what happens? That galvanic current actually causes mercury to be pumped out of the amalgam. So it cranks the mercury out faster than just grinding and chewing and drinking hot liquids and all that. So galvanicity is something, is a tool, and I would subscribe to the fact that the greater the galvanicity, those are the ones that should come out first. But I don't like to jump around the mouth, James. I really like to focus on one quadrant at a time. But I would go to the quadrant, like for example, I'd start on the lower left on Lori. And because of that galvanic situation with the gold next to the amalgam. Yes.
So if you had all of them removed at once, 25 years ago, which means, or more, which means they did not have these advanced waves, is there anything further you should be doing?
Well, you're in the right room, because I would definitely treat you as if you were mercury toxic and you have never, so I don't know what kind of protocols you've done since then. Oh, you're in good hands.
Not one of those fortunate
Well, you're in good hands because I mean, Dr. Tom understands what's going on, and especially his dental background gives him an even greater understanding of the types of things that you probably would be experiencing. So I treat everyone like they're mercury toxic. That have had amalgams removed at some time. Like, for example, when I see crowns in a patient's mouth, I'm like, oh, did you have old silver-colored fillings here before they did the crown? Oh, yeah. And you know how many crowns I remove and see a big blob of mercury amalgam under the crown? And that's another thing. Just because you don't see it doesn't mean it's not there. Right? We see this all the time in dentistry. And I'm always like, duh, why don't you even take that out? If anything, take it out because there's probably some recurrent caries, a recurrent decay under the old amalgam as well. But yeah, unfortunately, so that's something else. That's a good point that you're bringing up. So I treat everybody as if they're mercury toxic. Yes, Brett. You know what, I will tell you, I used to think the provocative urinalysis was great and, it's going to show me everything. And mercury is one of those things that it really hides. It's there. We're seeing more elevated lead and other things where the mercury doesn't really show. So the answer to your question is there really isn't a good challenge test. Sure. Yeah, I mean, and that's why I'm wary of results on some of these tests. Some of them are a guide. I have patients do biocompatibility testing. I used to use the Clifford test all the time, and I found that at best it's a fair guide of what I should stay away from. But even the stuff that said non-reactive, it could change, and they were reactive and that kind of thing. So it becomes and this is why bioregulatory medicine is the type of medicine that's going to create a healthcare model that's personalized for the patient. We have to we have to treat every soul as their individual life force and what's going on with that one person. There's not a blanket prescription for everyone. Anyone else? Yes?
Crowns, quite often when I look in clients' mouths, I can see it's a crown, but it's got a metal at the bottom.
Yeah, good point. Let me tell you a little bit about that, not to depress everybody, but in the 1980s, the price of gold went really high, and we started doing these PFMs, porcelain fused to metal. So gold used to be really popular with crowns. Lori has a gold crown. There's gold with, they used to bake ceramic and even bake acrylic on gold. Gold was always a very noble metal for full coverage crowns. But in the 1980s, when the price of gold went really high, dental laboratories started experimenting with less expensive, what we call semi-precious and non-precious alloys. They had nickel, zinc, lots of other cadmium. It's amazing. Nickel is such a carcinogen. Had a patient from Russia come to me the beginning of the summer. His son saw me on Dr. Oz talking about toxic metals, toxic fillings. I did a piece, toxic fillings, and he said, I'm worried that my father has mercury. And I said, well, he had all silver colored crowns in the backside on both sides and one quadrant on the bottom. Like basically 3/4 of his mouth was like, the James Bond movie Jaws with the metal teeth. This is what it looked like, except it was in the back. And I said, I don't know what's in here, but I'm sure because it looks non-precious, there's some nickel. The highest amount of nickel I ever saw was 26%. So I removed it as if it was mercury, And I used the same protocol as if it was mercury. And I removed the three that were on his upper left side, sent them to my refiner to analyze the metal. 77% nickel. 77% nickel. Here were his symptoms. He had, ever since the work was done, he had digestive problems and he had this burning feeling in his brain. He felt like his brain was burning. And it would flare up after he ate. Why? He was eating hot food or drinking hot liquids, the grinding. So he would, after he ate, he'd get this burning headache. He had CAT scans. So he went to all kinds of doctors, CAT scans, blood tests, nothing. And he was walking around, 3/4 of his mouth was 77% nickel. I think it's the grace of God that he didn't get cancer or a brain tumor. But it was really, I'd never seen that before. But it was a metal, and the metal was called, do you know the name of the metal? It's a metal that came out in the 1980s. No, it had a fancy name like crinoptolite, or that was, someone told me, Rexilium or something like that, that came out. So if you see that silver metal, you have to assume that there are some toxic metals in that, like nickel, especially. Yes, Lori.
Okay, I know we talked about this yesterday. BPA is a.
Composites.
What's the downside and get it removed?
Yeah, and unfortunately, there are a lot of holistic dentists that were taking mercury fillings out without a smart protocol and all this. And then on top of that, they were using most of the composites we have. It's called BIS GMA resin, and it makes BPAs. They're BPAs, and a lot of BPAs. And this has not been talked about. So I had a woman come to me from Washington, D.C., who had her amalgam fillings removed by a biologic dentist, and the guy filled for about 10 teeth with composite. 6 months later, she developed breast cancer. And I looked in her mouth when she came up. She was working for the United Nations. She was with the Indian Embassy in Washington, came up, was working for the Indian Embassy in New York at the United Nations, and came in, and she was being treated for breast cancer. And I said, when did the breast cancer come? And it was, well, I had all these amalgams removed because I heard they were bad, and I had all this stuff put in. And there are still a lot of composites that have BPAs. And the manufacturers, like I had one come to me, it was a Dentsply rep. Dentsply is a big dental company, and they had, I forget what their product is, and they said, look, it's no BPAs, except when you cure it. It makes BPAs. So there's no BPAs in the tube, but when you put it in and cure it, it makes BPAs. The best material that I found that I've been speaking about for several years now is a company, Voco, and the material is called Admira Fusion. VOCO and Admira Fusion. That's what you want your patients to ask for. There was another company called Hercules Kulzer, had something called Venus Pearl, which was BPA free, except they put fluoride in it. So, I mean, this is the kind of crazy stuff we deal with. So the only one that I like the most is the Voco Admira Fusion, and it's really good. It was a German scientist that came up. It's basically a liquid ceramic. It has very little resin at all, and it's mostly ceramic filler, and which is pretty inert. Another question? Yeah.
So the BPA, my son has 3 of them, and we had removed about 10, 15 years ago the mercury. So the BPA, what kind of problems will that be?
Well, bisphenols, raise estrogen levels, and they're estrogenic. So, we worry about, of course, breast cancer and prostate cancer, and it's harmful, and it causes a lot of endocrine dysfunctions. John?
Yeah. My knowledge of BPA free has been like the last 5 years.
That's correct. Yes. So if you had composites, excellent point. If you had composites more than 5 years ago, there's a good chance they may have BPA. So I'm going to wrap. I'll be around. We're going to do more questions. Jack, do you have something?
Quick context on that. Back in the 80s when the IOMT started, we were concerned about going from the frying pan to the fire and what is the safest material to replace amalgam with. And we actually commissioned a risk assessment expert to give us some sense on this BPA issue. And when he came back, after analyzing all the levels of exposure of BPA from any composite fillings or sealants, is another that's used in BPA, he found that on a relative value basis that the exposure to BPA from dental materials was extremely low compared to other sources like the plastic bottles and the paper receipts and that kind of thing. Yeah, not zero, but just to give some sense of relativity and some context.
Yeah. Now, the only proviso I have for that study is that the longer the composite is in and the longer it's wearing, the more exposure to your system. So it's a gift that keeps on giving. Maybe not as much when it's first put in and it's stable, but as they wear down, you do get more exposure. And I actually remove old composites with the isolation technique that I would use for an amalgam. And I think everyone, with something, Jack, that we should recommend at IOMT, that old composites are removed with the same protocols. Thank you very much. And